Good morning, dear colleagues. I'd like to start by apologizing for not being there in person. This is due to overlapping commitments. Nonetheless, I would like to express my profound gratitude for having invited me and WHO to participate in this very important and timely meeting. It is gratifying to note that the universal health coverage roadmap of Ghana is well aligned with other global initiatives such as the 2030 Sustainable Development Goals and the African Union Agenda 2063, the Astana Declaration on Primary Health Care, and the Universal Health Care 2030 Compact. And this roadmap is being implemented through the different tools, notably Ghana four-year health sector medium-term strategic plan. Dear colleagues, 2022 has been a year where most health systems around the world are recovering from the effect of the COVID-19 pandemic. Indeed, COVID-19 has affected the health care system and the progress towards the attainment of the universal health coverage in several ways. These challenges include the difficulty in providing basic and essential health services due to the health systems largely focusing on the response to the pandemic, the fear of infection, and indeed restriction of movement. I hope that we have learned key lessons from the pandemic on how we can build a resilient health system that is able to absorb shocks as well as continue to provide its routine essential services during public health emergencies. According to the Global Monitoring Report on Tracking Universal Health Coverage, while services coverage improved over the last 20 years, the proportion of persons facing financial hardships due to out-of-pocket health spending has increased. With rising poverty and shrinking incomes resulting from the current pandemic and global economic recession, health systems have struggled to provide continuity of health services. The COVID-19 pandemic is likely to halt the progress made towards universal health coverage, particularly among the disadvantaged populations. Distinguished colleagues, universal health coverage seeks to ensure access to a full spectrum of needed quality health services by all individuals without suffering financial hardships. Health systems provide services that can produce substantial improvements in the health of individuals. Indeed, primary health care approach remains a premier approach to addressing health and well-being challenges. Since the Alma Ata Declaration of 1978, it has been interpreted in several ways. However, as a principle, it has remained core to the design of health systems. The centrality was reaffirmed in 2018 when we met again with all the global health actors in Astana, Kazakhstan, to reaffirm primary health care commitment. As you are aware, the United Nations General Assembly adopted the 2030 Sustainable Development Goals with 17 interrelated goals. Under Goal 3, Healthy Lives and Well-being for all at all ages, universal health coverage is the umbrella target. What is the state of universal health coverage in our region or our continent? Since 2015, the World Health Organization and partners have been monitoring country progress on achieving universal health coverage. In December 2021, the World Health Organization reviewed progress on UHC, specifically how health financing policies can support increases in equitable service coverage and improvements in financial protection. While the Service Coverage Index has been improving globally from an average of 45 in 2000 to 68 in 2019, the incidence of catastrophic health spending has been increasing, placing a heavy financial burden on individuals seeking health care. The 2021 review noted that the world was not on track to achieve universal health coverage objectives. In the WHO region, African region, only 6 member states, namely Algeria, Cabo Verde, Mauritius, Namibia, the Seychelles, and South Africa, have managed to increase service coverage while simultaneously reducing catastrophic health spending. 10 member states, notably Angola, Benin, Cameroon, Cote d'Ivoire, Eswatini, Mauritania, Nigeria, Sierra Leone, Togo, and Uganda, have a very high level of catastrophic health spending, while their service coverage also remains very low. This indicates persistent barriers to access, while people who have access incur high out-of-pocket payments. Although Ghana and 26 other member states in the WHO African region have reported relatively low levels of catastrophic health spending, they still are reporting low service coverage. Distinguished colleagues, the path to attaining universal health coverage has a number of implications for our governments and indeed Ghana. The health sector needs to establish a clear list of interventions that the citizens of the country will and should be able to access without facing financial challenges. In this regard, I am pleased to note that Ghana has prepared its Essential Health Service Package. However, a few actions remain, such as the operationalization of the Essential Health Service Package, reconciliation of the package with the insurance benefit package, conducting the necessary financial and budgetary implication assessment, and strengthening the existing systems to continuously conduct and evaluate interventions to include in the benefit package. In terms of ensuring financial risk protection, I would like to highlight the urgent need to conduct a national health account study to analyze the expenditure in health, as well as its implication on the lives and livelihoods of individuals. Distinguished colleagues, information availability and use remains key in ensuring an evidence-driven policy guidance for universal health coverage. This is in line with the theme of tracking SDG 3 and exploring innovations and digital solutions. Countries need to shift emphasis from collecting repositories of data and statistics to also building their capacities for analytics and knowledge translation. WHO in our region has the means and ways to support this shift. On its part, Ghana has made progress in drafting the Health Information System Strategy, the ongoing Demographic Health Survey, and indeed the Harmonized Health Facility Assessment. Yet finalization and dissemination for use of the information strategy is, as well as conducting comprehensive review of the health system, are remaining tasks that I would like to request that the country completes. Despite the availability of various policy guidance, it is important that harmonizing and ensuring the interoperability of the different electronic platforms is addressed. As I conclude, I would like to assure you of the World Health Organization's commitment to supporting Ghana attain the Sustainable Development Goal 3, specifically through the full implementation of the Universal Health Coverage Roadmap and indeed translation of the National Health Policy into action. I would like to wish all of you a fruitful discussion, and I thank you for the invitation. Thank you.